Okay, so my name is Delaney, and in this presentation, I'm going to be reviewing the neurodegenerative disease rapid eye movement or REM sleep behavior disorder. So basically, we're just going to go over what it is first. We're going to go over the definition, the symptoms, the causes, as well as the prevalence. So REM, or Rapid Eye Movement Sleep Behavior Disorder, also known as RBD, is a sleep disorder that is characterized by the loss of skeletal muscle atonia during REM sleep. So skeletal muscle atonia is just the loss of muscular strength, or it's the paralysis of our muscles. So when we go to sleep, our muscles go into that very relaxed state, and that is what allows us to prevent, to not act out our dreams while sleeping. Patients with RBD do not have this. So therefore, the symptoms are typically reenacting dreams, so kicking, punching, flailing of the arms and legs. The dreams are typically very violent and very vivid, so patients recount their dreams of being confronted, attacked, or even chased. And due to this reenactment, it typically leads to injury. So they will often hurt themselves or even their sleeping partner while reenacting these dreams. So we're just going to briefly watch this patient experience video, just so we can get a sense on a personal level of what it is like to have this disease.
Violent, uncontrollable dreams, startling spouses, and leading to painful injuries. They are the results of a condition that's often misdiagnosed. Health reporter Haley Hernandez reveals what causes the condition and the medications that can be used to treat it.
Orvis Rig Rigsby and his wife Karen loved theater and travel.
He was a theater professor and I was a theater person, so for me it was really, there was a immediate connection, and we had a similar sense of humor, and it was just a lot of fun.
But just a few years ago, Rig started showing signs of dementia.
He had an incident where he got very disoriented and lost in our backyard, and that's when we started looking for help from a neurologist.
At first, Dr. Ira Goodman thought Rig had Alzheimer's disease.
And actually, I'd initially referred him for a clinical trial for Alzheimer's disease, but right before you entered, I changed my mind.
Instead, Dr. Goodman diagnosed Rig with Lewy body dementia and REM sleep behavior disorder. The condition, seen here during a sleep study posted on social media, causes a person to act out violent dreams.
There have been fractures, there's been subdural hematomas, and as far as spouses or bed partners, there's been reports of up to 2/3 of bed partners being injured during an episode.
Sometimes he would just start yelling, or sometimes he would start punching around. Sometimes it was like he flew off the bed.
Currently, there is no cure. Rig wears a patch that helps ease the symptoms, but keeping a watchful eye is the best defense.
If he's having a bad night, I'll sleep in the bed with him and hold my hand on his shoulder.
Dr. Goodman and Karen Rigsby say not to be afraid of getting evaluated if you notice any symptoms.
I tell everybody, don't waste time, don't waste time, don't wait, don't wait, don't wait. That's all you can say.
A clinical trial is underway for a new drug called nilotanserin to treat the REM sleep behavior disorder. Klonopin, an anti-anxiety drug called clonazepam in the generic form, is most commonly prescribed, but it has side effects. Another option, the dietary supplement melatonin. Haley Hernandez, KPRC, Channel 2 News.
So for the incident rate and risk factors, typically this disease occurs in individuals who are 50 years of age and older. If RBD is diagnosed in individuals who are less than 50, it is considered to be early onset. RBD is also pretty rare. It occurs in about 0.5 to 1% of the population, and it does have a higher incidence rate in men. Now, while it has not been confirmed yet, there has been some research that does suggest there may be a potential genetic link with RBD. So causes. The cause of REM sleep behavior disorder is still unknown. That is why it is referred to as being idiopathic, meaning there is no known cause. It's just the sudden appearance of symptoms. That being said, there are numerous studies that have been conducted investigating potential causational factors. So again, as I said, the official cause of RBD has yet to be determined. However, there was one research experiment that I looked at that injected rat subjects with a virus to genetically deactivate the glutamate neurons in the sublateral dorsal tegmental nucleus, or the SLD neurons, to generate muscle atonia. They found that while glutamate SLD neurons are not required for the generation of REM sleep, they are responsible for the generation of muscle atonia during REM sleep. So if these neurons are deactivated during REM sleep, then you're not going to have the activation of muscle atonia, and therefore you might reenact your dreams. So that was pretty interesting. As seen in the video, the patient had dementia as well as RBD. So RBD has been known to be diagnosed with another neurological disease, and it has also been shown to progress into another neurodegenerative disease like Parkinson's disease, Lewy body dementia, and multiple system atrophy. On average, research does suggest that the risk of progression into another neurodegenerative disease is between 30 and 65%, with that risk increasing over time. So how is RBD even diagnosed? So first, patients will often refer to their doctor, their family doctor, and that doctor is going to look at the patient's medical history and symptoms. Then they might be referred to an EMG to record the amount of phasic activity in certain skeletal muscles. And then they might be referred to PSG to reveal the loss of muscle atonia during REM sleep. And that then it's just going to kind of go from there. So treatment. So there are two main treatments that are often used, which is clonazepam and melatonin. Clonazepam is the first line of treatment for RBD and is often prescribed for people with anxiety disorders and repetitive seizures. Melatonin is also used. It's typically used for patients with insomnia to help induce sleep, but it does show to reduce the symptoms in patients with RBD. Zopiclone is more of an experimental drug. Patients do report having very adverse side effects with clonazepam. And some research has found that many patients who are on Zopiclone for RBD found that drug was very effective in reducing symptoms, and it also came with more tolerable side effects. So local treatment centers. So for sleep clinics in Nova Scotia, we do have a few that provide patients with sleep assessments, diagnosis, and treatment as well. And there are numerous locations all across the province, including in Halifax, Lower Sackville, and Bridgewater. So these are just my references that I use for this presentation. So if you guys want to kind of dig deeper into this interesting disease, then feel free, and thank you very much for listening.